to talk really quickly about humanitarian medical aid, infectious disease modeling, and some of the issues around real-time data. I want to start with thinking back to 2019 and two of the cyclones that hit Mozambique, cyclones Idai and Kenneth. They hit between March and May of 2019. They caused a really significant cholera outbreak, both in the middle of the country and in the north. We had some key questions at the time directed to medical aid organization, particularly in supply chain. We were looking at the scope and scale of the outbreak, population vulnerability and risk, and particularly where the disease is heading in real time so that we could assess demand for vaccination and treatment. To do that, we had some key data sets, the Facebook high resolution settlement layer, satellite imagery for understanding the flood extent and cholera endemicity, which is done through Justin Lessler's team at Johns Hopkins. We started, in the response before we actually had a data model worked out for understanding the cholera outbreak, but as we kind of progressed, this veered towards actual formal epidemiological modeling, and there were some key limitations in that. So understanding population movement, who's moving where, and then who's infected. Case data was reported in PDF format, difficult to use. The mobility piece in particular, we attempted to use Facebook disaster maps, which was based on user locations with the Facebook application. And this was very sparse outside of the major urban areas. So we had to then use a gravity model for probabilistic understanding of movement. So based on the attraction of various population centers, integration then of a flood model and an incidence model based on what I was describing earlier. To solve the case data issues, we used manual inputs from the epidemiological bulletins that were published. And you can find some of the outcomes of this in the pre-hospital and disaster medicine publication, Rapid Forecasting of Cholera Risk in Mozambique, which really emphasized also the translational dynamics that are at the heart of this. So we had to work closely with Ministry of Health and with WHO to translate model inputs and results into actionable insight, and to learn things like, given the types of data constraints on the Ministry of Health side, the most useful work here ended up actually being GIS to turn high resolution population into administrative 5-level boundaries so that we could help to guide understand the population in each of the vaccinators' neighborhood areas. Subsequent to this type of event where we're attempting to develop and implement a rapid epidemiological model for disaster response, the same group that convened that began to work on understanding how to implement mobility for social distancing. The app-based data that turned out to be so challenging to use in Mozambique, given the sparseness, turned out to be extraordinarily valuable in the case of pandemic response, and where we worked with groups like Facebook and others to be able to understand the rate at which movement was increasing or decreasing in various geographic areas at the county level, turned into open data, which is now published on the Humanitarian Data Exchange and is hosted on a live dashboard to be able to inform policymakers about the response to their distancing decisions. The translational issues there were really buttressed by the networking of researchers into what was called the COVID-19 Mobility Data Network, which published really customized analysis of mobility and infectious disease for key public stakeholders to inform the adaptation of their policies to the pandemic situation over time. And this since then has been formulated into a framework for the organization partnership CrisisReady, which is between Direct Relief and Harvard School of Public Health, around the requirements to make this stuff work. And that really is a combination of data readiness, so having those data sets ready to go, pipelines that are activated, methods that enable models to be put together, but really that translational readiness being at the heart of what we need to do, so that we have networks that are capable of responding quickly. And this has turned into a similar type of network called the Disaster Mobility Data Network, which you can find through the website on CrisisReady, and is a partnership with the Global Facility on Disaster Risk Reduction through the World Bank. And that is my lightning talk. Thank you very much.